Hi, everyone. My name is Deanna, and I'm one of the directors with Premier Behavioral Health Services. With everything that's going on, first and foremost, we want to let you know that Premier Behavioral Health is offering telehealth services. The platform we're using right now is actually Zoom, which is one of the ways that you can connect with any of our providers. But you can also give us a call if you'd like to speak with somebody via phone, or we have another tool called Doxy.me at our disposal in which we can connect with you. During this time, since we're not doing in-person visits, we felt that it would be really important to connect folks with some of our providers who can shed some light into what's going on. And the first provider that I'd like to introduce you to as we do this series is Dr. Mekota. And we'll certainly introduce what he does at the practice, but also have him answer some helpful questions or offer some helpful tips to questions that we've been receiving in regards to the COVID-19 pandemic. So Dr. Mekota, hi, how are you?
I'm good, thank you. Yeah, so like Deanna said, I'm one of the clinicians at Premier Behavioral Health. I'm actually a neuropsychologist there. So a lot of what I do relates to sort of assessing our minds, how we think about things, and how it might relate to our emotions or vice versa, and how what our mind is doing or how we're thinking might influence how we feel about things. How we feel about things then might, alter how our minds work, such as how well we can focus or how well we can remember things. So where does that fall into place with this? Well, there are certainly things that we can do or that we don't do that can boost or sort of adversely affect or negatively impact how sharp our minds might be working. So when we're not now with everything going on, a lot of us are staying at home or following the shelter-in-place orders, and our structure, our routine has been uprooted, and we know that our bodies, our brains, our minds thrive really off of predictability and structure, and that can really change. And then sometimes when we're doing that, we become more and more sedentary. We tend to maybe do less or maybe watch Netflix instead of doing something like going out that we might have otherwise done. So with all this going on, it's still really important that we do the things to keep our minds active and sharp. And one of the big things that I recommend is exercise. Physical exercise tends to have a really powerful and strong short and long-term impact on our mental sharpness as well as our mood. It's a great antidepressant. It's a great anti-anxiety, sort of treatment, things that we can do. So, you might have been used to going out to the gym or going somewhere or having that as part of your routine. Now, maybe less access to that, maybe more, again, sitting or doing less moving throughout the day. So building that in as part of your day has now become really important. And there are lots of ways you can do that. A lot of people throwing up, different exercise plans just to do at home because there's a lot of these folks who had gyms are also staying at home. And so having time each day or multiple times throughout the week that you do that, to take care of your brain, take care of your physical health, and therefore also then take care of your mental health. Another thing I think, is important to remember is just generally having a good structure, since not a lot of that has been uprooted, has shifted, it's no longer maybe there as much, might be as going up or down from the basement, to do work like such as I am, but, still having some plan to the day, some organization to it that's carried over from day to day is also a really good idea and can help, keep you feeling productive, like you're getting things done, and certainly still leaving plenty of time, hopefully, for relaxation and leisure activities and connecting with people and friends, things like that.
Sure. One of the things that I've heard from folks and from my own family is that they're really getting consumed with all of the information that's out there in regards to COVID-19. And it seems to pretty much just take up a large portion of each person's day. What do you say to that? What do you recommend to people who are just sitting, watching news coverage, reading news articles? What should those people do?
Sure. I think it's definitely important to be informed. We want to be informed about what's going on, but I think there is a difference between being informed and then letting, certain information consume your mental life and consume, much of your day and predicate what you're doing and thinking about. So setting limits for yourself, I think, is important. There's only so much new information we even get about the COVID-19 on a daily basis. Sure, there are things coming in, but is every tiny snippet going to widely expand your understanding of it or enhance your preparedness? And I totally understand it's a kind of an anxiety-provoking time, and that's okay. Uh, but the anxiety can kind of pull us in to do things that almost expand that anxiety and feed it, and things like consuming all that media around what's happening with COVID-19, uh, one such thing that can maybe start expanding the anxiety rather than helping us keep it manageable. So setting limits is a good idea. I think maybe you do a half hour to an hour a day. Set a boundary of how much time you're going to spend consuming all of that, and then um, also keep mind of what your sources are. Check and see what. Not everybody is getting like 3 verifications for everything they're putting up. Um, Sometimes certain uh, websites or channels are kind of based on viewership numbers and getting as many viewers as possible, getting as many clicks. So try and search for sources that are maybe a little more neutral. So some groups like the CDC or the World Health Organization, they have less of a vested interest in trying to get numbers or viewers. They're hopefully more interested typically in just presenting facts and what is known and what is maybe not known. So limit the kind of sources you're getting, and recognize that some of what might be put up might be kind of twisted a little bit to make it seem more attention grabbing. And when you really read it, you see, oh, okay, well, it's not, maybe exactly what the headline suggested. So having those more neutral and science-based, outlets is recommended, I'd say.
Excellent. And lastly, one more question that I want to ask you is, for many parents out there, it is a struggle to find, we're really tasked with educating our kids at home, trying to manage working and trying to kind of have a structure for them. What kind of guidance can you give to parents that are new to all of this as well?
Sure. I think it's, probably provide new respect for our teachers, I'm sure, but
Yeah.
and all much they have to deal with. But, I think we have to be a little bit more lenient because our youngsters, our little ones are, it's almost like days off. They're used to being at home during the day when there's a snow day or on a holiday or a weekend. So they might be a little more rambunctious. Kind of being mindful and aware of that fact is important. A good place to start from when the expectations are set. But then again, kind of as you mentioned, building that structure, building some routine back in, and maintaining it so that, okay, we're going to do from here to here is when we go, and then we're going to do some work, and then we'll have a little break, do something else, and then come back, and having that set up. So there's, again, that predictability. They're more likely to then slip into that and adapt to that change or that new structure. I think is an important way of things to keep in mind. And also, it's not going to necessarily be easy on anyone. And again, so providing a little more lenience and being aware that it's a new situation for everybody can help perhaps ease some of the stress, and everyone pitching in together, getting the husband involved and both parents getting involved in teaching and helping manage the new expectations and the new ways things are going, at least for the time being.
Well, thank you so much. I really appreciate it, Dr. Mekota. For those of you who are watching, please know you can reach out to providers like Dr. Mekota if you'd like to schedule a time to see him. Our front desk is available. But above all, we certainly recommend, and I think I can speak for Dr. Mekota as well, that if you are experiencing any kind of anxiety or depression or added stress towards becoming overwhelming, please speak with someone. Whether it's Premier Behavioral Health or another provider, there are excellent resources out in our community, and we strongly urge you to find someone that you connect with that is available and you can begin therapy with.
Absolutely. Yeah.
Well, thank you very much. We appreciate it, and certainly stay tuned for some more, and maybe we'll have Dr. Mekota on at a different time to bring up some other topics. So certainly email us if you have any questions, okay? Thank
All
you.
right. Thanks a lot. Bye-bye.
Bye.